everything. So again, I'd like to welcome everybody for coming today. We're so happy to see you. This is our first Coffee with Gina in the new year. I think we can all agree that we are thrilled that it's 2021. Yes. Thank you for joining us. Can everybody hands or a thumbs up if you can see and hear me? Wave to me. There we go. Okay. By the way, just so you know, you'll be muted unless you have a question. So if you have a question, raise your hand and we'll keep a lookout for that. And then Joyce will unmute you so that you can ask your question of Joel. Is that correct? Okay, thank you. So today is a great day to ask those questions because we're highlighting a special topic that combines health and technology to help us better understand the mystery of telemedicine. What is it? How does it work? How might this impact my medical care? What are the benefits? What's the downside? What's the upside? What should I expect? How do I prepare? Lots of questions about telemedicine. So many of you have heard the term, and I'm guessing many of you have also experienced it. There's so many questions surrounding this growing area of healthcare. We brought in our top expert as our special guest. Joining us live is Joel Barthelemy, founder and CEO of Global Med, based in Scottsdale. Global Med powers the world's largest, most advanced virtual health programs by designing and manufacturing integrated software and hardware telemedicine solutions that support patients at any point in the continuum of care. Joel is a past member of the Sun Health Board of Directors. We understand that you may have questions, so please be thinking about them and we'll address those at the end. Unless it's an urgent, burning question and you have to have the answer right now, raise your hand and Joyce will unmute you. But before we begin his presentation, it's noteworthy to mention that the delivery of medical care has evolved through the years and actually ties to our Sun Health Foundation story of a 5+ decade community support for healthcare. The earliest foundation members, as many of you know, went door to door to support community hospitals. And it's truly an amazing story. And the growth of healthcare has paralleled that as well, with 2 hospitals, an entire network of services in the community. And these services are available in the community because of the community. So today's Sun Health Foundation continues its legacy as we partner with Banner to provide the great care at Boswell and Del Webb Medical Centers. So now it gives me great pleasure to introduce our guest today, Joel Barthelemy. Joel, would you like to step up and take the microphone from here? Thank you.
Thank you, Gina. Can you all hear me?
Yes.
Good, excellent, thank you. So as Gina had shared, I have been blessed to have been on the board at Sun Health for a number of years, the services board, and I had enjoyed that so very much. I've learned so much from the staff at Sun Health, the excellent leadership and team members that you have there. So it's an honor for me today, such an honor to be here today to tell you a little bit about what I've been focused on for the last 20 years. So next slide, please. I have some help there from Joyce in the background. So I want to share a little bit about how telehealth is embedded into our healthcare landscape today, and and why I think it may be a presentation that goes 2 or 3 times, right? So today in the first session, what I'm going to cover is the history of telehealth and what the different terms mean, because you're going to see many different terms, and you probably heard them, such as remote patient monitoring or virtual care. I'm going to spend some time on the benefits of virtual care, and then I'm going to do a small little demo, play a video, a demonstration how telemedicine works. And then lastly, I'm going to focus on a little story of John, a congestive heart failure patient, and how telemedicine has helped his family. Next slide, please. Some people think that telehealth is a modern invention, when in fact, providers have been using telemedicine and remote care since the 1800s, believe that or not, when the telephone was first invented and doctors started talking with patients over the telephone to hear what their symptoms were. Today, telehealth is a sophisticated and what we call evidence-based care delivery model. Last year alone in the United States, 41 million telehealth claims were filed in just the months of April through July. That's 41 million claims for telehealth during just those few months. And 1 out of 5 healthcare visits last year happened through telemedicine or telehealth. Now let's go over some of the terms you might have heard. As you've heard me interchange so far, telehealth, telemedicine, and virtual care. Those are the ones that you probably hear the most of. But then you may hear some or read some articles in the paper that talk about iHealth or e-health, so electronic health. Or you might have heard the term remote patient monitoring, and we'll focus on that a little bit more. Another term, mHealth. If you hear mHealth out there, that's usually referring to mobile health. So that's your cell phone that has information on it or an application on it. Another term you might hear is chronic care management, or CCM. That usually takes place in the home. And one last term that you probably have read about, which Banner Health uses a great deal of, in fact, they're one of the pioneers, is the EICU. So the ICU, the intensive care unit, electronically, so EICU, you will find where you may be in the hospital inside the ICU, but your physician, your caregiver, is miles away inside a command center where they're monitoring patients all over the country that are in different ICU beds. So the EICU, very popular. So next slide, please. So let's talk about some of the benefits of, excuse me, of telehealth or telemedicine. So telehealth is an integral part of the EMR, your electronic health record, right? So they should interchange between the video and the data systems coming off of a telemedicine consult into the electronic health record, so that the data is kept on your well-being inside of a electronic system. Telehealth brings care to the underserved. So think about patients living in rural areas or disadvantaged areas. Telehealth controls costs. So for patients, payers, and healthcare systems, when health systems utilize telehealth or telemedicine, you're normally getting care much earlier than you would if you had to schedule an appointment, go to the office, or go to the urgent care, and so on. So when you get care quicker, many times the outcomes are better for you because they're dealing with your issues very early on. And that then in turn lowers your cost of what you're paying for your health care. It lowers the cost to the payer that you're getting your insurance from, and also to the healthcare system. Telehealth optimizes the care coordination and the patient outcomes, as I just said. And the better that you can communicate quickly, as I shared, is just much better for everyone. Telehealth provides evidence-based complex care, as we talked about with the EICU. As you'll see in a moment, though, providers can treat chronic disease and serious conditions virtually and still exchange that clinical data within the healthcare electronic record. Next slide, please. For another example of an advanced telehealth solution, our company, GlobalMed, enables complex, evidence-based clinical experience, not just a symptoms-based approach. The symptoms-based approach is when you call your doc either on your cell phone or your landline, and you say, here are my symptoms. I have a cold, I have this as an issue, I have a runny nose, that type of thing. That's symptoms-based, and so often your physician, your caregiver, can go ahead and diagnose and or give you a prescription. Providers that want more data and data-driven devices, including HD or high-definition cameras, stethoscopes, ultrasounds, electrocardiograms. That's your complex care. So they're getting more data and more information, along with the software that the doctor uses to communicate remotely and the workflows for the different types of care they deliver, like dentistry or hearing loss or your diabetes or hypertension. Think about the ear, nose, and throat, being able to, as a physician, being able to look inside your ear and see your tympanic membrane, or look down your throat and actually see the cobblestoning effect on the back of your throat, which they would normally do in person with a flashlight. But because they're doing it remotely, they need to have cameras to do that for them. That clinical data too, that comes from the virtual visit, as I shared before, integrates into the EMR. So now the doctor has a complete picture of your health and your medical history. One of the things that you probably have read, and if you haven't read about it yet, you will soon, is the security that's needed for health systems and you as a patient being able to know that when you talk to your physician or your healthcare provider, that in fact it is secure, that because you're going through the airways, because you're going over the internet, that you don't have to worry about that data being breached. And every single day there's an article of a system that has been breached out there within the healthcare arena. And so that the security is paramount. Products like Zoom have security built in, but you will find over the next months and years, I doubt that Zoom will be used for healthcare. And so it's going to be more technologies that are really based strictly for healthcare, not for all sorts of things like meetings or morning coffee. So let's take a look at the video that Joyce is going to play for me, and I'll explain a little bit what's going on. You'll see a gentleman that is in a hospital bed in a rural area. That patient, let me see if I can get, that patient is, sure the video's, okay, there it is. That patient that this technician is going in with has issues with his cardiology. So he's having cardiac issues. The cardiologist is literally miles away, is not inside the hospital that can see this patient. So there's a cart that rolls in. The doctor being, again, miles away, the cardiologist can sit down to their computer and dial in and utilize and zoom that camera into the patient. And then the patient can talk with the physician, and the medical assistant can talk with the physician. And in fact, the medical assistant is now putting a chest piece on, and the physician is hearing the heart and lung sounds remotely. And in fact, the patient's heart sounds are better remotely than they are in person because of the digital amplification of it. Now the patient has been getting put a 12-lead EKG on, and that 12-lead EKG is now providing the electrocardiogram to the patient, allowing the doctor to get the interpretation from the software and the different electric pulses throughout the patient's system. As you can see here on the screen, he actually gets to see what's happening from 1,000 miles away. The consult continues, the patient can ask questions. It's actually a really great way for patients to get that highly complex care. Now I'm having a little trouble getting back to my screen, so let's see if I can do that here. So give me 1 minute. Okay. Now you got to love it when your laptop freezes on you. Are you still there, everyone?
Yeah.
Okay,
Yes, we're
good.
here.
Sorry about that. Okay, so now I just want to share a story. Are we on the next slide? Because I can't tell. John's story?
Yes, we are.
Great, thank you. So the story I want to share with you is very close and dear to me, although I've changed the names. This is something my father really suffered with. And so I'm going to talk about John and his daughter, Kristen. So John is living with congestive heart failure. He lives in a rural town that is 2 hours away from his cardiologist, much like the patient we just saw in the video. And that's really not an unusual situation because 1 out of 5 Americans live in rural areas in the United States. So having to travel 4 hours round trip and wait with the doctor, wait in the office to see his cardiologist for each appointment was sometimes a little too much of a burden for John, and he began to start skipping his appointments. Again, in America, that's not unusual. And in fact, around the world, it's about a 40% no-show rate. Luckily, though, his care team set John up with an electronic scale, a pulse oximeter, and a blood pressure cuff, and the monitoring so that he could use that at home. Now John sends daily readings in, and his care coordinator contacts John immediately if she has any questions or spots the need for an intervention. John is actually getting faster treatment and closer monitoring than a patient who only attends office appointments in person. But he's not the only one affected. His daughter, Kristen, lives in Chicago, and she worries about her father living alone, and especially with the medical issues that he has. She asks him what the doctor tells him, and she doesn't always get very many details. I don't know if any of you have had that issue. I know I did. My dad asked my dad what the doctor said, and he'd forget 90% of it, and then he would give me misinformation. But now for Kristen, she virtually conferences into her father's appointments and gets to hear what the cardiologist shares, the updates in her dad's condition and the details about the care plan for her dad. In the event her father is hospitalized, she can also participate in the doctor's rounds, and she does that staying informed about her dad virtually like we're doing here today. So already you can see benefits of telemedicine for this family, and that's just the beginning. And when we do have part 2 of this, we'll find out more about how telehealth has changed both Kristen's and John's life. So with that, I'd like to hear any questions you'd like to ask this morning. Does anyone have any questions? Or Gina, I can turn it back over to you.
Well, I think that if I could just jump in with a real quick question, I think, when I think about telemedicine, I kind of go to this place where I think I'd rather be having a face-to-face with my doctor, and there's so much that you can, learn that way. And yet how you've presented this gave me a whole different perception of the importance of technology in healthcare and telemedicine and telehealth. But I do wonder, from a business perspective, Joel, is there a difference in cost if you have a telemedicine appointment? Is that the same as if you're in person? And then also, in addition to the cost factor, what about the patient experience? How should we prepare for that? And maybe talk a little bit about that, if you would, Joel.
Sure. So there are so many different models out there for care virtually. And so you'll find that sometimes if you're going to do a virtual consult, they're free because your healthcare payer wants you to engage digitally before they're going to have you come in. A typical cost of a telehealth consult, so the cost, the doctor's time, and so on, can be $40, $50, whether your insurance company is paying that or if you're paying a copay on that. If you go to an urgent care, the typical cost of that is about $300. If you skip urgent care and you're concerned and you go directly to the emergency room, that cost can be upwards of $3,000 and $4,000 or more. And so how many times have we, or someone we know, gone to the emergency room to find out that there's really nothing wrong with us, we just need to go home and rest a little bit? And so insurance companies, payers, they really do like to pay for your telemedicine consult first. So you may see your doctor on your phone, on your mobile phone, or on your laptop or tablet, because it's not necessary for you to go in, and therefore the costs, bring those costs down. So often that amount is covered with many different systems. Gina, did that answer your question?
It sure did. Thank you, Joel. And I saw that Betty Lynch had in the chat room, she was asking a question about, sometimes broadband or technology is a little bit unstable. So how do we ensure that this is available to people in areas, maybe, underserved areas or poor areas where people can't even get access to some of this? Did I capture your question correctly, Betty? Was that kind of your question? Okay.
It's a great question.
Yeah.
Betty, with internet today, it's better than it's ever been, but again, yet it's not perfect, and especially in the rural settings. The Federal Communications has put out grants for rural and underserved areas in the United States where they can get better connectivity. But 3G and 4G and now 5G, which we hear about every day, when 5G is fully deployed, if and when, 5G will change everything as far as connectivity. It's 80 times faster than 4G. I mean, so many times faster. But in the rural areas, you'll find that what still happens is patients have to either, if they don't have it in the home, if they don't have broadband in the home, that they do have to go to the city center or the rural little area, go into the coffee shop, go to the grocery store, wherever that has better bandwidth to get a consult. There is some new technology that I'm very excited about, and it comes from the same man that did SpaceX and Tesla, and that's Elon Musk. And in the southern hemisphere of the United States now, there is a service where you get direct satellite to your home for high-speed broadband. And so today it's in the southern hemisphere of the United States, and it's available. So you could live in Havasupai Canyon and have 200 megabyte up and down roughly to your location there at the bottom of the Grand Canyon, as long as that little dish antenna can see the satellites. So he's put up thousands of satellites to provide this, and I think within the next year it'll be available throughout the United States. So hopefully that will help. But broadband is really necessary for a good consult for your healthcare provider to hear and see what they need to see.
Thank you, Joel. We have several questions coming in, so I will take these in the order in which they're showing up in my chat box. So Pam Betts was asking the question, well, how are physicians being trained on telemedicine? Or is there, you and I had a discussion, Joel, about some physicians were kind of resistant to this until they understood how simple it was and what it did to their net, their bottom line. So could you maybe address Pam's question about how are they being trained?
Pam, great question. So today in most medical schools, they still don't really teach telemedicine or telehealth. They talk about it in general terms, but that is changing. There are more, I know that USC is now putting much more time and classes in regards to learning telemedicine and telehealth. The University of Arizona does a great job. They have one of the most sophisticated telemedicine programs in the world and have been the teachers of doctors and healthcare providers and companies around the world, and that's at UA. And that is the Arizona Telemedicine Project. It's funded by our state legislature in Arizona, and a great program. But what happens is most physicians, they got, well, let's say this, about 90% of physicians up until last year had never done a telemedicine consult. 90%. Because of COVID, that number is now like 80% have done a telemedicine consult in just 1 year's time, less than a year's time. And so for those of us in the industry, we talk about COVID being the worst of times, and unfortunately, the best of times, because we've been forced into utilizing this type of technology, right, to see our doctors, to see our healthcare providers, to counsel with psychologists and or the care teams that need to help us do a better job of taking care of ourselves, right? And so today, as I shared, just in a few months, 41 million telehealth consults. One more story that I know of is that the VA trains the majority of the United States doctors, because when docs go through their internships and their residencies, they a lot of times do it with the VA. And so the VA last year, prior to COVID, had a mandate with every physician on within the VA ranks, 10,000 plus, that they had to deliver at least one telemedicine consult during the year 2019, 2020, because their year kind of overlaps. So this was just prior to COVID, but every doctor had to provide at least one to stay credentialed within the VA health system.
Interesting. Wow, 41 million, huh? What interesting statistics. It went from 90% not experiencing to 80% experiencing. Excellent. We have a couple more questions coming through. Anna, where's Anna Scheit? Anna had raised her hand, and I think there she is. Anna, if you wanna ask Joel your question.
I live at Grandview Terrace, and I wonder, how does one find out if one's physician, primary care physician, or even others are connected into this telemedicine? And if so, how do I get the information?
Yeah, very good, Anna. Thank you. So the number one thing to do is talk with your primary care physician's office, talk with the personnel there, and see if they have the option. Most of the time, your primary care physician and or the health plan should explain where and how you can receive telemedicine. I thought it was funny here, the middle of this year, I called to see my physician because I didn't have my annual checkup. I had just turned 60 and I wanted to make sure that I saw my physician, as I do every year. And so I called the office, and the receptionist said, of course he does telemedicine. Okay, so what should I do? She said, well, just stand by, he'll contact you. So here I'm thinking he's going to do a FaceTime, or he's going to have me download an application. And no, my phone rang, and I pick up my phone. He goes, hey, Joel, Dr. Ross, how are you? I said, I'm fine. He goes, okay, so, and he just started to ask me questions about my healthcare experience over the last year, and really that there were no changes. And that was my telehealth consult. That was my primary care visit for the year, which I thought was kind of non-evidence-based. He strictly went off of what I told him. I could have been deathly sick and told him I was good, and he would have said, okay, you're fine, nothing to, no changes. And so for you, if you do contact your physician's office and find out, hopefully they have some sort of app on the phone that you can download or on your computer, and your doctor can actually get a little bit better information when they see you over telemedicine. Thank you.
Thanks for that great question, Anna. Jane Caesar, are you still on with us? Because I know you had a great question too. Would you like to ask Joel your question from a professional? Jane is a wealth manager and second generation Sun City business owner. And so Jane, would you like to ask the question of Joel?
Good morning. Joel, this is remarkable. I had some sense of this. You and I had talked about it a couple of years ago, but
Sure.
I had no idea of the scope, and I congratulate you. This is going to change the world, obviously. My question was, is Medicare and our most major insurance carriers already providing benefits for this, or is that early stage in progress?
Fabulous question, Jane. Good to see you again.
Good to see you.
So now I live in Florida now, and so I don't live in Arizona anymore. But in Arizona, you're so blessed because the state legislature over the last 5 years has continually implemented legislation for parity. And just like our legislatures do, is they give us little pieces of legislation, or in this case, reimbursement to the physicians for something. So in this situation, over the last few years, it used to be heart failure, dermatology, and so on were covered, and you had to live more than 40 miles away from your physician, right? So you had to be in the rural areas to actually utilize and your doctor get paid. But as of January 1, 2021, we have full parity in Arizona. So if you can be seen and a doctor can get paid for something that ails you, today, whatever that reimbursement is for Medicare, Medicaid, the insurance companies, whether you have Blue Cross, Aetna, Humana, they have to pay on the same rate, and pretty much most everything is covered. So there should be really no difference. Jane, also on that, last year with COVID, the Center for Medicare and Medicaid, CMS, and HHS, Health and Human Services, really relaxed a lot of the laws and pretty much made the physician license available outside the state licensure that the docs were licensed in. Mm-hmm. And so in February of last year, only an Arizona licensed physician or caregiver could actually give you care. But because of COVID, the CMS and HHS reduced that and eliminated that to say you can see a doctor in Florida or Maryland. It doesn't matter. If you have a physician that can see you, you can be seen, and that doctor can get paid. So we anticipate, as COVID hopefully leaves our country at some point in time here, that it's possible that HHS will retract those licensure laws, and we'll go back to states and compacts with states on the licensure. But it is believed from many of the organizations that I work with that the reimbursement will stay on a national level. But in Arizona, I know this is a long-winded answer, in Arizona, you're in great shape. One of the leaders within the country that our state legislature has been at the forefront of.
Thank you, Joel. Excellent. Good to hear.
Excellent question. Excellent answer. Thanks to both of you. We then had a question come in from Mr. and Mrs. Sue King. Sue King, would you like to ask your question of Joel? You can unmute.
Yes, hi. I have a general question. As of right now, are there any particular things telemedicine cannot do yet? We still have to rely on the in-person visit. And also, so far the telemedicine, I and my family experienced it, do not use any devices, like the doctor cannot hear my heart and lungs, and they pretty much relied on my verbal telling him or her how I feel or relied on a camera. When do you expect, in-home devices can help us to communicate with the doctors at real time?
Yeah, excellent question. So number one, you can go to your CVS or your Walgreens and you can pick up some of the different devices if you want to pay for them yourself, such as a pulse oximeter. Pulse oximeters are $50 to $75, and that's that little device that goes on your finger that gives your oxygen, right? And so, and if you get one that is Bluetooth enabled, then it can actually talk to your phone if you can connect them. The same thing with a blood pressure cuff and or a thermometer. And so it really does help your physician or your nurse practitioner help in your diagnoses if you have some of those devices. And my suggestion too is that if you do purchase one, look on the package before you buy it. Make sure it's an FDA approved or cleared device, because those devices, the physician can look at when you utilize them, if there is video. So let's say you were using during COVID time, FaceTime. And so you could use FaceTime or Zoom and show him the device from your camera phone. And as long as that's an FDA cleared device, the doctor can pretty much take that as diagnosable. But some fun technologies are coming, Sue King. We are working on technology with ASU, and we acquired one of the companies that we're part owners of, acquired the patents on visual vital signs. Now imagine this. You're looking at your cell phone and you have your camera on, and the camera is reading the little striations around your mouth, right? And it actually gets your temperature, it gets your heart rate, and it gets your blood pressure without having to wear a device, right? You don't have to go buy something else. And so I have been in some of the early stage demos of this, and I am blown away that the phone's camera can actually gather that information. So I think you'll see in the next few years, the fact that you won't have to go buy a device, that when you're doing a video with your doctor, that the camera at the same time is recording your vital sign information, and the physician can rely on it because of its clearance through the FDA. So there's several companies working on that technology. Some get the information from around your eyes. Others, like ours, is getting it from around the mouth. So it's a whole new world coming our way, and powered by telephones.
Wow, that's good to know. Thank you.
You're welcome. Thank you for the question.
My goodness, what a great question and great information. It's a little scary, I guess, that a phone could pick up on all that, but yet if it's used in the right way, that's technology that helps all of us. Jerry Solomon, you had a question that I think you wanted to present to Joel. Would you kindly ask that?
Hi, Joel. Good to see you.
Hey, Jerry. Good to see you, sir.
How about regulation? You inferred in part of your conversation that, we could be downloading apps. Does that mean we'd have a different app from every doctor? Does anybody keep track of these telemedicine calls? What kind of regulation is there going to be in the medical industry for commonality?
Fabulous question. At this point in time, I don't know of any regulation as far as commonality for the video call. I do know the commonality for the data that's brought into your EMR. There is forced legislation coming there where the different EMRs have to share that information nicely between each one of the electronic medical record companies. But these are multi-billion-dollar companies, the big ones, and they are fighting that legislation and those laws as much as they can, because they're trying to keep their share of the market. When there is commonality between all of these shared EMRs, that's a good thing for the consumers, maybe challenging for the big EMR companies. So as far as other legislation goes, it really comes down to the security of the apps. And as I shared, the HHS had lessened the requirements for the HIPAA rules and fines for physicians utilizing different applications. But everything that I've read as of late shares how products like Doxy and Zoom are not going to be looked at favorably in the future for healthcare visits, unless they make some big change to their technology. And they're smart companies, so that's very possible. I think that is our number one concern, is the fact of no one, breaching our phone call or our video call or our data of what our results are from diagnoses. Yeah, we don't really want anybody to see that doesn't have any right to it. So good question, Jerry. I hope I answered it.
Good. Thank you, Joel.
Great.
By
Great
the way,
question. Great
I
answer.
think Microsoft has announced they're going to start looking into Teams and a medical variation for it.
Oh, wow.
Yeah, Teams. We as a company, our data is kept at Microsoft's on their Azure web, and because we, as a company, provide care to the military, our technology is used throughout the military. It's used within the VA, and it's also used within the White House and Air Force One, Camp David, all the secret facilities. We put more into each year into our security profile than many companies spend to write their software. And so we're excited that Microsoft is going to work towards better technology for healthcare. Most of the data is kept there when you work, especially within the federal government, and they use the Microsoft platform. So that would be a good day for us as a company when Microsoft fully embraces the security level of healthcare delivery.
Excellent, thank you. There's a couple more questions that have come through, Joel, if you have another minute or two.
Sure, I've got 15 minutes.
Oh, cool, let's do it. To your point about the military, I remember when robotics was first becoming popular, and that actually came from the military also. They would send robots into the battlefields to do things. And then they started using robotics in surgery and all of that. So it's interesting, the parallel between the military and healthcare. Judith Flaskerud had posed a question. Judith, would you like to ask Joel? And then I see there's a couple more coming through. We'll get to you in just a minute. Are you still with us, Judith?
I'm with you. My telephone is ringing and I wasn't talking. I've had the same doctor for 30 years. With telemed, will there be any kind of continuity of doctor-patient relationship?
That's a good question. If I think I understand the continuity of care, which I do understand, that it's seamless. The fact that your data and your information and your health and wellness is all contained with that caregiver. Now, if you've seen your caregiver for 30 years, it is possible that caregiver may or may not embrace telemedicine. What we are finding is healthcare is very complicated. Healthcare administration is even more complicated. How many people have been to the physician over the last year or two? And it seems like all they're doing is typing on their iPad or their computer as you're talking with them, right? That's because they're putting all that data into the electronic medical record for continuity. For instance, if the physician that you're seeing today at 30 years now, he's putting that, if he or she's putting that information into electronic health record, tomorrow when your healthcare provider retires, if they do, the new provider that takes over has all that information about you and your health situation. So the continuity is for you should be there through the electronic medical record. However, you might not be able to see the same physician in the future. Did that help at all, Judith?
Yes and no. My provider never used a method of typing in. He took notes, somebody else transcribed it later.
Oh, good, good. Well, so then the data did get into...
The doctor knew me because of a long period of time of association, which I think has been important. With telemed, I see us losing that possibility.
Yeah. Yeah, I think each case is going to be a little different. Hopefully, your physician is open to the technology, and I'll just say, if you like, you can give Gina, if you could give my information and the company information to Judith or whoever else wants it. We can do our best to help your doctor understand what they can do today to help you through that type of situation. That's one of the questions earlier, Judith, was, or actually Gina just mentioned the fact that, over the years, telehealth has changed so much. For the first 10, 12 years of being in this technology space, the majority of my conversations were explaining what telemedicine was to physicians, to nurses, to hospital administrators, to the common public. Because I would say telemedicine or telehealth, and they'd be like, well, what is that? You mean you can see your doctor over your phone? And so that still exists with a few folks out there, less and less every day. But our biggest mission and vision as a company is we want to see the disparity in care eliminated. And so with that as our top vision and mission, the elimination of disparity in care, we're happy to help in any way we can and just direct the doctor to using Zoom for now or using something else for now. Because it's important to us that every person, whether you live in Sun City or you live at the bottom of the Grand Canyon, or you're in the jungle of Peru, or you're on an oil rig, it doesn't matter. We as a company, we as individuals want to make sure that everybody can get the best care they can in the shortest period of time, even if it has nothing to do with us. Right. It's just kind of the moral responsibility we engaged in by being in this industry.
Yeah, thank you, Joel, for that. Excellent, excellent conversation. I believe we have one more question. Jim Greenwald, you were waving your hand. I'd love for you to share your thoughts and ask your question of Joel.
Hello, Joel.
Hello, sir.
The thing that I found interesting is the impact of telemedicine, technology, and now the coronavirus. My son is a radiologist at Andrews Air Force Base, and now they're required that the doctor, in his case, has to stay home and work from home 2 days a week. But what's happening is, because of the new technology, the computer he has, the quality of the screens he has, he's now able, they can get those films to him, those images to him immediately, and he can go back and forth with the doctors at the hospital, even though he's still at home. And to me, this is just a fascinating change in medicine today.
Absolutely. And to your point, Jim, radiology was one of the very first modalities of care or service lines that largely embraced telemedicine because of the technology of being able to see those films remotely on high definition screens and or their Mac laptop that has a high definition screen built in. And so it's good. I've been to Andrews Air Force Base when I went out onto Air Force One to put our system on Air Force One. And thank you for his service at Andrews.
He had spent, he just retired as a bird colonel. He was in Iraq and so forth as a radiologist. So
Fabulous.
yeah, he's had a great career in medicine.
Excellent.
Wow. Well, are there any other questions or comments? And always, if you think of something afterwards, oops, there's one more question. Who was it? Anna, did you have another question?
Yes, and I'll put it quickly. We switched doctors, and talking about the records that the doctors keep and enter into the computers, I asked for copies in order to see what was there and transfer it to was being transferred to the new doctor. There were some awful inaccuracies there. How does one correct that once it enters the computer?
Wow, that's a difficult question. I think we're all responsible for our health, and if not us, then we need an advocate. And the advocate, sometimes when we don't have a family member that's available for that, can be someone like Sun Health at home, the Sun Health advocate. And so it's because of privacy, Anna, you have to get that information, but then hopefully you can work with somebody from Sun Health to make sure that that data, if it is incorrect, that they can help you get it corrected for your new healthcare provider. And there's no reason why a new healthcare provider wouldn't listen to you and take the right information down, because they don't want any erroneous or orphan data that is inaccurate and incorrect. So that's the beautiful thing about the majority of the folks on this call. You have the most wonderful advocate in Sun Health to help you through that. And don't, and I'm sorry, Jerry or Gina, if that's not the service you provide, but I believe it is. And that is one of the most wonderful things about Sun Health is I believe they're there for you. And so with that, I need to probably close up here, Gina.
Yeah, Joel, that was like you. We certainly are committed to supporting people in the community to get the best care that they absolutely can. And the people on this call are curious and wanting to be informed. So any of you, if you think of questions afterwards, you're certainly welcome to send those along to us, and we'll get that to Joel and we'll make connections that way. Joyce, you hear from Joyce all the time with these links, so you can send her the questions also. Speaking of Joyce, her 5-year-old daughter Tegan, so a 5-year-old has to go to the doctor for certain things, and Tegan doesn't like to go in person. Tegan likes to use only her phone for her doctor appointments. So that is the wave of the future. Tegan was going to be with us today, but she had a big project at school, so she wasn't able to join us. Joel, thank you. Thank you for your presentation today, and thanks everybody for joining us. Just a quick close here. I want to see if Joel has a part 2 to this story and also a part 3. And if there is interest from this group, we would love to have a wave of hands. Tell us if you want us to book, another session, probably about 60 days out or so. We have quite a few things coming up in the next 60 days, as does Joel. So if there is interest from these nearly 50 people on this call today, we are happy to book him again. And Joel, you're a hot commodity here. We're going to have to get on your calendar for the session. So thank you very much.
Too kind. Thank you,
Joel.
You're very welcome.
Thank you. Such an honor.
Okay, so I want to be respectful of everybody's time, and so we're going to kind of close things up here. These coffees with Gina and Friends have just been amazing. We've heard from physicians, we've heard from entrepreneurs like Joel. We continue to stay connected with the donors who've been so generous to support the campaign. Very, very exciting. We're 63% to the goal of the 48 million. So we have some ways to go and a lot of exciting things going on in the emergency department, in cancer work, in women's care, in orthopedics, in our wellness programs. All of those are going great. Just a couple of dates that I'd love for you to think about and maybe get on your calendar. The new emergency department over on the Boswell campus is going to open. Well, it is open, but we're going to have the dedication very, very soon with the new beautiful donor recognition wall that connects to the new tower over there. That will also be virtual, but stay tuned for that because Joyce will be sending you that invitation for late March, where we're going to have our annual thanking donors of the difference you make, and you'll be able to see the gorgeous donor wall and the names on that. We also love for you to join us at our golf event on April the 17th at Top Golf. That's such a fun event to do. So you can contact Janine. I think it's on your screen right there if you have interest in learning more about our Top Golf event. And then we hope that you'll join us for future coffees as they come up. And we conduct these regularly. We would love feedback from all of you. If you have particular topics or something that you're curious about, whether it's healthcare, whether it's related in a different way, we're so blessed and fortunate to have access to medical professionals and nurses and hospital CEOs and cancer physicians and all kinds of contacts that we can provide information to you. So keep those suggestions coming in. I believe this suggestion to demystifying telemedicine came from one of our regular attendees. So thank you for that. And we'll keep you posted on these upcoming events as well. And as always, your well-being is very important to us. So please do not delay your own health care, whether it's through telemedicine. We don't really want you to go to the emergency department as a patient, but hopefully you'll be able to join us when we do the grand opening there. So with that, I believe that I will close for the day. We have 1 minute left, and so you'll have the gift of time. So stay well, stay safe, and stay connected. Thanks so very much for joining us, and we'll see you next time. Bye-bye.
Bye-bye.
Thank you, Gina. Thank you. Thanks, Joe.
There they go. What's that?